Alright, you are live. Very well live now.
Testing ke rakam terus?
Testing tapi after this terus masuk lah. Okay. So I top chat. Okay, how do I check the chat?
Hadi, can you check the live session kat Ilmu Seks ni channel?
Can you?
Dia kat mana?
I'll open a laptop sebelah sana lah. But sekarang dah live lah, macam everything is set. So let me just masukkan dalam lagi. Ya, boleh nampak. Okay, you can start. Well, no viewers lagi. Hi Anna Silversea. Okay.
Ada orang ke?
Yeah, ada orang. So you can start now. Okay, 3, 2, 1.
Very Ilmu Seks punya realness kan? No editing stuff. Okay. Hello everyone, my name is Mussy. Saya daripada Ilmu Seks, dan pada sesi kali ini, sesi siaran langsung, kita akan bersama dengan dua orang tetamu jemputan kita untuk membicarakan berkenaan HIV AIDS di Malaysia. So, permulaannya kita memang dah rancang untuk ada lagi ramai panelis, tapi memandangkan semua sibuk and semua ada yang nak pecah ke hospital or whatever. Okay, jadi kita ada yang seadanya lah. So, bersama dengan saya ialah Cik Jeremy daripada PG Foundation ya, dan Puan Cubaida daripada MAC. Jadi saya tak akan intro dalam-dalam. Saya benarkan, saya nak pastikan panelis kita ada masa yang tersendiri untuk mereka perkenalkan diri mereka. Jadi saya jemput siapa? Puan Ju dulu ya. Puan Ju daripada MAC. So ya, silakan.
Okay, Assalamualaikum dan salam sejahtera. Saya Puan Cubaida dari Malaysian AIDS Council dan juga ESCO untuk Malaysian AIDS Council dan juga ESCO untuk Penang Family Health Development Association pada. So saya punya pelibatan ya sebenarnya, actually I'm a retired nurse counsellor from hospital Seberang Jaya Pulau Pinang, and my involvement in HIV/AIDS program started in '97 until today. I never stopped lah. Alright, so that's where because I've been given the task to run the ID clinic in hospital Seberang Jaya. So that's where I got myself involved with NGO, and I invited the NGO to come into Kementerian Kesihatan because we have to collaborate with Kementerian Kesihatan in order to reach our clients. Alright, so we do a lot in FADA and also in MAC. We do a lot of awareness program where we do counselling, testing, and also treatment. We refer them to the nearest clinic kesihatan and also to the nearest hospital, treating them. So with that, I would like to share with you all what I have on my slide presentation from MAC. So basically, you all know about what is HIV. You know, it's the name of the virus, right? So how the virus gets into the human being is only through and if you do not take care of HIV, you do not address HIV issue, you will end up becoming AIDS, right? So you do not see AIDS anymore nowadays because we have started our treatment program since '97, when we started with only a single dose. But now our treatment has, we have the 3 combination, which is so good. It can suppress the virus, so you do not see any more AIDS, acquired immune deficiency syndrome. Where I saw all the AIDS patients way back in 2002 in Hospital Sungai Buloh, the Oleh Hospital Sungai Buloh. So you do not see them because we always treat them early now. So that's why I have my longest standing patient who's on heart since 1997 until now, and he's still alive and well. Alright, so next, you see, so this, I think you know how it is transmitted, right? It is transmitted through sex, yeah? Unprotected sex, and then we have, of course, sex without condoms with the infected partner, right? If you have unprotected sex with your partners. Next, so the other way of transmission is through sharing of needles, yeah, infected needles, This is among the drug users. Okay, drug users, or whereas actually we have succeeded this. In fact, in Malaysia now, we are only 30% only the infection through drugs because of our needle exchange program that we started in 2006. We implemented by the Kementerian Kesihatan, and I think I can tell you the data in Penang State last year. Penang State only had one drug user who is HIV positive. One out of the whole Penang State. But I do not get the data for KL. But I'm telling you is that the risk among the drug users are very, very low now. Is because we are giving them clean needles. So the other thing is that we succeeded in this is our methadone replacement treatment, where we give them methadone instead of injecting in the form of syrup. So that has helped them a lot. And we do have patients who started on methadone, and they have been on methadone for quite a number of years, and now they have weaned off the methadone and they are living quite a normal life. They can go back to society and they are working. Alright, next. Then we have, of course, through mother-to-child transmission. This is another field that we are already succeeded. I just went for a meeting with MAC, with WHO, with Kementerian Kesihatan, that we have already succeeded, and in fact, we have been validated that we already recognize in Southeast Asia that we are among the countries in Southeast Asia with only 2% of babies born positive. And this 2% also is actually not diagnosed. I mean, they do not come for any antenatal treatment. They do not come for any antenatal checkup. So our mother-to-child transmission is being addressed when we started, once the program started in 2002, where we give heart to all, we call it START at that time, we give START to all pregnant women with HIV positive. So we prevent the transmission of the child, so the virus is being suppressed, so that most of the child are born normal. Right? So this we have succeeded. In fact, very good. Malaysia has succeeded, and we just, during the last National AIDS Conference on the 29th and 30th of September, we also, they also appreciate our, I mean, we were being looked upon with our achievement, even by the WHO. Alright? So we are proud of this, that we address all these issues now.
Sorry?
And then the other thing is that transmitted through blood transfusion. This is another issue that we started our screening all HIV, we started screening all blood donors in 1986, where that was the first case of HIV in Malaysia. So from there on, all our blood are being screened before we gave to. But we so far we are quite successful with our blood donors, because we do not take any blood that is been screened positive HIV. We throw them away. But we do have one case that is in Bali, by one Ustazah lama dah, 2007 if I'm not mistaken. She was diagnosed positive through a blood transfusion after an operation. So her was a rare case where the donor was given, the blood donor at that time, I guess was not honest, number one. Number two, maybe it was during the window period. So you must remember about HIV, they have the window period. You can be negative, but the virus is there. There is a window period. That's why that's why when we want blood donors to be honest, if you have any activities that you think can give you a high risk activities, like you have just had sex, unprotected sex, or you are sharing needles, or all these unprotected activities that you need to be honest about before you go and donate your blood. Alright? So we are very careful about this in Kementerian Kesihatan. Next. So, of course, you should know, these are all the questions that the public will ask you. Do I get from kissing? Do I get from sharing food, sharing utensils, and then do I get from sneezing, coughing, and also if I hold a person or hug a person living with HIV. No, all right. And the other thing is that they didn't put here is mosquito bite. A lot of school children ask us, do I get an HIV when a mosquito bite me? Well, if you will get Aedes, dengue. You get the Aedes mosquito will bite you, you get dengue, but you don't get HIV. All right. So that next. And of course, all these mosquito bite, I was telling you about this now, working in the same place, and then when you share the public toilets, and also touching, okay? You do not get, these are not the mode of transmission. Next. So, this is what we want, pencegahan. Our main aim here is prevention. So that's where we go all out with our condoms, giving them condoms. Yeah. So Kementerian Kesihatan has given lots and lots. In fact, our NGOs get from Kementerian Kesihatan all the test kit and the condoms free.
Oh really?
Yes. If you want free, you can get it from any clinic kesihatan. We give you free condoms and free testing in any clinic kesihatan. You can get it. Alright, so we also give the free condoms to all the key population, our MSM, our transgender, and our drug users. Next is, and then our prevention is our sharing of the needles. I was telling you about is the needle exchange program plus the methadone replacement therapy that I just spoke just now. So that's called the harm reduction. Harm reduction where we give them the needle. We give them 3 needles and syringe, and they will return us back the 3 and we replace them back. Okay? We go to the pots to give. We have NGOs going to the pot. We have the outreach workers to go and give them needles, and they will give us back. Alright? And our methadone program, we have already recruit all these drug users who wants to change to methadone. They'll go every morning to all the clinic kesihatan near their house to get the dose of methadone before they start the day. And they will be given by a doctor, and we will step down there. We will start with a very high dose, and then we will slowly reduce the dose. We will tail off the dose until it becomes a normal to them. So they do not need to crave for the drug anymore. That's why we succeeded. Next. So we also have our mother. I told you about the mother to child, where we screen all our antenatal mothers since 2002, and we treat them, and we give free milk for all the babies born with HIV mothers. We give them free milk because we stop lactation. We do not allow the mothers to breastfeed, so we will suppress the lactation. We give them medicines to suppress the lactation, and the mothers are given free milk throughout the baby's lactating time. Until 2 years, we give them free milk. Right? So that's why we succeeded in bringing down the risk among babies born with positive mothers. So Malaysia has succeeded, and it is an achievement for us. Right? And then the other thing is that ujian pencegahan is where we do a lot of our, you can go to any clinic kesihatan or any NGO that have, we also have our partner organization. Example, in Penang, we do our community-based testing. We call it community-based testing, where we go to the community and do the testing for them. Alright, contoh, if we want to do for the transgender, we go to the transgender community. We go there and we do the counseling first, and we do the testing, and we refer them for treatment. We take them for treatment. We have outreach workers to do all this. For example, in Penang, we have our MSM clinic, and we do every two weeks at night. We have staff to go in and test their blood, and then if they are positive, the next day we'll bring them to the nearest clinic to get themselves treated. Okay, we do not wait for CD4. Now our Kementerian Kesihatan policy is once detected, we send the blood for confirmation and straight away we treat them. Because our test kit is very sensitive now, very good, that we can we only need 2 tests to be positive to label a person to be HIV. So what we do is, if you do the screening, the VCT, we do the voluntary test counseling and testing that we do, and once we use our test kit is positive, so that is considered one test. So the other one, we will take blood from them, about 4 cc or 5 cc, we'll send to the lab to do the Western blot to confirm the diagnosis. We call it for confirmation. So once it's confirmed, we will do the post-test counseling, we will send them to see our FMS in all the klinik kesihatan. They have the first line. Now Malaysia has given, Kementerian Kesihatan have given all the first line treatment to all the FMS, family medicine specialists, in all klinik kesihatan, that they can treat HIV positive patients. So that's why our access to treatment is very easy now. Alright. Next we have the treatment kini berkesan. Our antiviral treatment is so good that we can suppress the virus. We have patients living with undetectable virus. We do a viral load every 6 months, and we do the CD4 also 4 to 6 months. Initially, we will start off with 4 months, and once they are stable, we see that the CD4 is good, because you know what is CD4. So that once the CD4 is up and the virus is down, so the patient has, in fact, can lead a fairly normal life like you and me. Nobody knows that they have HIV. Alright? So our treatment is so effective now, and now we have already got the 3, very soon, the National AIDS Conference, they say that we hope and pray that in US they have the 3-in-1. That means the patient just take 1 dose daily, 3-in-1. Because now our patients have to take twice a day, every 12 hours. Alright? So that means they have to take 2 times. One, let's say if they start at 8 o'clock in the morning, the next dose will be at night, 12 hours. But if, well, I don't know, inshallah, when we have the money, maybe we can buy the 3-in-1. So the patient just need to take 1 tablet a day, just like any other chronic ailment, like you have high blood pressure, or you have diabetes, or heart failure, or a kidney failure. You just have to take your drugs every day for the rest of your life. Right? It's the same. It's a chronic. HIV now comes into chronic ailment. So we treat them as any other chronic diseases. Alright? Next. So then with the good treatment that we have access to early treatment, you can lead a fairly normal life. I have my patient, long-standing patient, live for more than 20 over years, and they're so well. They're living, and they can see the children grow. I also have couples who are positive marrying a negative, and positive marrying a positive, and have beautiful, normal children. Alright, so it is not an issue now. So all our treatment is available in all government clinics, free of charge. All Malaysian, only for Malaysian, right? Only, only for Malaysian. But if you are foreigner, then we have to pay, or we refer you to the UN AIDS.
UNHCR.
We have to refer you to the United Nations, because we do not treat foreigners, because we there's a ministry's policy that we want to treat our people first. Because if you are, let's say you're a Thai or you're a Indonesian, then you can go back to your country. Their country also gives them free treatment. They also can get free treatment in their own country. So that is not an issue for them. Even if you go to Singapore, you can go. I mean, if you're Singaporean, we send you back to Singapore. Alright, next. And of course it's free. Yes. Next. Okay, this is I just want to show you an overview of the HIV epidemic in Malaysia since in 2016. This is the data, we got it from Kementerian Kesihatan, given to Malaysian AIDS Council. So you know the newly HIV infected, you see in 2016 we have 3,397, and then total reported HIV since 1986, that's the first case, until today, you see the figure, very alarming. And AIDS-related death, okay, we have lost 900 people, right? And then our total reported AIDS-related death also, that was since 1986. In fact, you see a lot dying during that time, the whole of 19 and early 2000, you see a lot of death, right? Total people living with HIV, we have 93 now, and 93,000, and now our HIV notification rate is every per 100,000 people, alright? And new HIV in women and girls, we have 413, 12,578 is for total reported HIV in women and girls, that is during 1986, alright? New HIV infection in children is very low, below 13 we have 15 only. I told you our figure is very low now. And then total reported HIV in children below 13 years old, since 1986, we have 1,146 patients. And then total reported HIV in people who injected drugs. And total reported cases of sexually transmitted HIV is 33,000. Alright, all that one is since 86, since the first case detected. Okay, next. It is the same, this is the notification rate that we see from 2000, this is from 2000. That's why we say in MAC that these are all the reported cases to Kementerian Kesihatan. If you see the figure, if you were to read it, and you can see. But you must remember, there are about 3 times the amount who are not reported. Okay? So we don't know about the 3 times yang walking on the road patients, clients who are not reported. You get what I mean? That people don't come forward to us. We want to reach them. These unreported cases, we want to reach them and treat them. Okay? So we have to all of us have to work together to get these unreported cases. Okay? Next is, okay, the notification rate. Of course, you have one. See you see the graph. Yeah.
This one based on age.
Age group,
yeah,
yes. This is the age group. Okay, you see the young people are getting more, middle age 30 to 39, and then for the older, for 20 to 29, you see the 3,000 is new infection, and the old people you have 9%, and the children is only 1%.
So the majority is 20 to 30.
That's why it's your all your age group.
Am I young?
You all your age group, all the varsity students and the students.
We are contributing.
All right.
But this one is 2016 year later. Okay.
2016.
17 haven't came out yet.
That doesn't come out yet.
Okay. It'll be interesting to know what's the latest statistic.
Yes. New cases, macam 1986 to 2016 also, you see the 98, your initiation of mother to child transmission program, we started early 2002. You see the 2002, we already screen all the mothers, and then introduction. In 2006, I told you we started our harm reduction. And in fact, we started in 86, the 3 reported cases, but you see we step up, and until today, 2016, our new cases is 3,000. Alright?
And it's quite consistent from 2010.
Yes.
The latest stage is much consistent.
But this is reported cases, my dear.
Yes.
We do not know about the unreported cases. Alright. Next. Transmitted by sex. Okay, you see the male and the female. The male, you see, the male is 2,000. 2016. Total reported HIV in male population is 89%, 99,000 males. Alright? And you see the female. Female is mainly we detect them from antenatal checkup. Okay?
But it's interesting that I don't. Yeah, I wonder like because we should have a Q&A session after, but I'm just curious because we do know that most of the stereotype of sex worker is female. Yeah, but it's surprisingly male dominated.
Okay, but actually now our statistic for male sex with male is 70% in Malaysia.
Yeah.
I told you the drug users only 30%.
Yeah.
Okay, it's under the sexual activities lah. Heterosexual pun ada because we still have men having sex with women, but men having sex with men is higher in Malaysia now, and not only Malaysia, because when I went for the Malaysian AIDS Council conference, in fact in Thailand also the same. The Thai presenter also claimed that their sex with men is higher in Thailand too. Okay. The risk factor, of course, this is for the mother to child, they're very few, and for the drug users, for the IDU, intravenous drug use is only 4. But you see the homosexual, 46%, heterosexual is 39. So you see, basically, the mode of transmission in HIV here is through sexual activities. And of course, you see the homosexual is 46%, and the hetero is men sex with female is actually only 39%, but it's still under the category of sexual activities.
Yeah.
Alright? So next. Percentage of HIV in ethnic group. So you see, you have the Malays 69%, Chinese 15%, Indian 8%, foreigners 4%, and others 4%.
Is it including this is very how we classify the Borneo?
Others, no, they are still Malaysian. I mean, if they are under Kalimantan border, they are Indonesian. But if they are still Sabah Sarawak, they are still Malaysian.
Under this
Others
ethnic categories, I'm curious.
Ethnic, maybe we don't know their origin, you know, they also don't know where they come from, you know, but very small percentage of them, where they do not know where they originated from, and then you ask them, are you Malaysian? After they will tell you yes, and then they said no, and then after they say they are from one island or don't know where, we do get stuff.
Unverified cases.
Unverified.
Unverified
We
cases.
do not know where they come from, we just put them under others. Because like foreigners, you know they have a passport.
Yes.
You know that they come from Myanmar, or they come from Philippines, or they come from Thailand, or so you can. But these are the people who do not have identification also.
Yes.
So it's quite difficult to categorize them.
Yeah, I think I will love to raise the issue about the undocumented person after this. So we will move on to the next.
This one is comparison with no during injected drugs. And sexually, you see dulu, last time, our drugs, you see the green arrow, last time the drug was very high, you look at now, it's only 300, compared to last time 4,000. So you see the sexual activities, it has gone up to 2,864, compared to last time 1,500. So that's why our awareness program is on protected sex. That we want to tell the young people or whoever is indulged with sexual activity. I'm not only talking about the key population, it can be for the general population.
Yes.
Right? We sometimes only want to pick, oh, you are the key population, but you never know.
Yeah.
After I share with you some of the key population experience, but let's go on to the next slide.
Oh.
I think finished. Okay. So talking about the key population that I told you just now was sometimes when we are saying, oh, the female sex workers or the female transgender, but actually when I go out with my NGOs to do community-based testing, I find out we go to all the pots, we go to all the bushes, we go to everywhere that they have the activities, we go to their brothels. Actually, they are all very aware of protected sex. We are worried now is the young people out there who do not use any protection when they have sexual activities.
They're a little bit raw, I guess.
Yes.
Yes,
I don't know what they want, but anyway, they are being diagnosed early and they are pregnant, and we have to start. I have a patient as young as 14 years old, as young as 16 years old, pregnant, detected positive, and you imagine their life starts from there. And they have to take their medication, their heart, highly active antiretroviral treatment for the rest of their life. Alright? So that's where we cannot always say that, oh, we want to always say, oh, you are transgender or you are a sex worker, that we are worried that you are the one who causes the infection. No, because our awareness program through this community is very good compared to the public out there. If you ask me, that's why I would love to go to more places like institutions like this, places like schools, because our patients are getting younger, 14 years old, 15 years old, 16 years old, they are actually in schools. And why are they positive? Right? So that's where that we need to do all this awareness program, in fact, as early as maybe 13 years old.
Yeah.
We should think of it. And in fact, Kementerian Kesihatan has already voiced this issue with Kementerian Pendidikan in Malaysia, that they are looking into this issue. Maybe we have to go to the parliament, work it out into policies, then where we give awareness program in schools.
Yeah.
As early as Form 1. But this have to be in the policy. We cannot go to schools and talk like that.
Yeah.
But I have gone to all schools in Penang State, where but I did it with my father group, but we did it for Form 4 students. Form 3 students after the PT3.
Yeah.
When they have just before the school ends, we go in and do program of awareness for them. But that's where it is good, because they are already going to be 16 years old, they are 15 years old. But now that I'm worried is patients are getting younger than them. Okay, so we hope that our policy makers out there will look into this issue and take action as soon as possible. With that, I open to any questions or.
Okay, talking about you, hold on. Let's just silence the microphone.
Let's take
This is awkward.
No, it's live.
Bali live.
Okay. Is this thing will be heard?
Just wait for 5 minutes.
Thank you. Okay, now, since we're talking about you, I think we could shift to our next speaker, which Saudara Jeremy,
Not
will
take.
representing the youth, golongan belia, and also PT Foundation. Jadi, let me start here. You can introduce yourself.
Okay, so I introduce myself first. My name is Jeremy. I'm currently with PT Foundation as an Internet Outreach Coordinator. So most of my slides somehow already been mentioned by Puan, some of the statistics given by the Ministry of Health and also Malaysia AIDS Council. So I'll be talking more from the youth perspective, what are some kind of the issues that we're actually facing, and what are some of the challenges that we hope can be discussed in the future. So this is basically what has been mentioned before about some statistics of the total numbers reported of AIDS, HIV, and also the death, and also people living with HIV. Next. So this is actually a very interesting graph for us to look at. Because you see, in the past, the method of transmission of HIV is injected drug user. So we can see that it actually, it was so high in the first year that it started 2015, and it actually consistently dropped across the years. But so the question is that why it drops? It's because of the introduction of the methadone program, the harm reduction program, the clean needles, so on and so forth. In the past, when we start introducing the harm reduction programs, what is the society reaction? It's also bad, it's negative. People say that you guys are crazy. You are giving the drug user clean needles to do more drugs. You are making drugs an epidemic in our country. But we show them that this is wrong. When we implement the harm reduction programs, we give them clean needles, it reduces. So HIV is no longer that prevalence in the IDU, the injected drug user. But when we come to sex, because you see we are Asian people, we are so conservative with sex, we don't have sex. But then we look at what's the result. It consistently, the red color bar, it consistently increased every year, and now it's still increasing. So it's the time for us to actually think back. Is it the time for us to relook of the attitude toward the sex and the approach that we use in the school? We use abstinence. Is it really working? And I do agree with what you say. What we are advocating is the safe sex. It's the protected sex, because that is one of the methods we can prevent the HIV rate continue raising every year. Next is almost the same. Next. The figures is almost the same.
Figure is the same.
Oh, this is the trend, is it?
Yeah.
Yes. So
This is the proportion.
yes, this is the proportion of what you can actually look at. The proportion actually changed. It used
Homo
to, the majority used to be the heterosexual. In 2008, only 10% is homosexual. But you can see that the pie chart changed subsequently, become much more equal throughout the years. And in 2016, it's almost half, 54 versus 46.
Yeah.
So is there an explanation for that rise of, to say not homosexual? I think the good term is MSM, right? So do you have any explanation for why suddenly there's a
Rise
it looks like a very drastic increase from.
One of the possible explanation could be that as years develop, because in the past we don't have social media, and currently when we look at social media, we have a lot of risks there. Why? Because in social media, the hookup apps like Grindr, so on and so forth, the rest, Hornet, people are promoting raw sex, bareback sex, and then not using condom, and all these sexual behavior are the high-risk sexual behavior. So one of the possible explanation of why it's actually increasing is the switch of the technology, because in the past, where people got sex, it's always sex worker, so on and so forth, or through drugs. But now, because of the technology changes, people hook up with a different way by using technology. So that could be one of the possible explanation of why the pie chart become equal nowadays. Because we know that most of the MSM or some transgender, they are using all these gay apps. And since there is all this high-risk behavior there, it somehow put them at the high-risk groups in getting HIV. Yeah, you can go next. So okay, this is one of the aspiration actually come up with the UN AIDS. So they have come up with this great target that they want to achieve 90. So the first, for each of the for all the states, for all the countries that go under the UN, they want them to achieve the first 90, which is everyone living with HIV actually aware of their HIV statuses, so that they can reach to the second, where after you know your HIV statuses, you could be able to receive the HIV treatment that you're supposed to take. And after the last 30 is that after they receive the treatment, they will be able to reach the undetectable stage, which is the viral load. And in UN now, everyone is talking about the U equal to U, which means the undetectable equal to untransmittable. When you receive the that's why we keep on promoting, if you are HIV positive, it's okay. And in our country, since the treatment is free, you just get the treatment, and until your body reaches to the stage of undetectable, you can't even transmit the virus into another person, because the quantity of the virus in your body was so low, you couldn't even pass it to another person. Next. And almost the same next. Okay, and in Malaysia also we come up with our national strategic plan of how to end the AIDS. You can just go Google online and get the document and have a thorough read of how they actually have different type of strategy according to age range and different key population also. Okay.
This is a strategy
Yeah,
plan.
so basically this is a brief idea of what the strategy is about. The first strategy is talking about the testing and also the treatment. Second strategy of looking at how we can actually improve the quality and also the coverage of prevention programs in our country for the key population. And then the third strategy, they look at how we should reduce the stigma and discrimination to the key population so that we can, not only the key population, stigma and discrimination as in general, so that we can promote more people coming to have testing rather than being stigma, being slut, being sexually active, so on and so forth. And the last strategy is just to ensure the quality strategic information and how we can how the policymaker and also the planners through monitoring, evaluation and research can come together in reaching the last strategy. Okay, so it's going to be long, but bear with me.
Yeah.
Okay, so I will be talking about some of the program what PT have actually been doing. Next. Okay, this is the so far the program that we have. So the I-Power, the Internet Outreach Programs, and then the second is the community. We have our own healthcare clinic, which is the CHCC in Sentul. And then we have our MSM program where we provide the social support to the MSM population after they need people to accompany them to the hospital or they need social support. Our staff will be there for them. And yeah, and then the last one, because we believe that the last program is called Second Chance Program, because we believe that when we talk about HIV, we somehow neglected women a lot and also girls, children. So the Second Chance Program provides free tuition, free education for the girls, for the mothers where they don't have high education. So we provide a platform for their children who are affected by their life because of their parents' HIV statuses or because of their own HIV statuses to have a chance to learn. Because many of the clients from the Second Chance Program are mothers who are migrants. They are mothers from different countries, so they are working. They don't have the time to take care of their children. So our program somehow give them a chance to send their children to our center so that we can teach them a basic syllabus at school.
So is this the one that I want to double check with you? Like, is this the one that you always organize happening on Pelincir every Sunday?
Yes, yes. We have the tuition classes every Sunday 2 to 6 p.m. Occasionally, we will have program like sex education. So we teach the children how to recognize, how to protect their body, what are unconsensus touching, so on and so forth. So it's like teaching children not only academic stuff, but also teaching them stuff about in lifestyle, how to protect themselves, the life skills, a little bit of life skills, so on and so forth.
Oh, shit.
Just next. Okay, so we used to do the value-based. It's like community-based testing. So we reach out to people. We go to the community. We tell them what are the certain risks. And maybe you can move to the next picture since this picture is a little bit like too big and sexual.
Okay, sorry, I'm so horny. Okay, bye.
Next, we move to the next picture. Okay, so this is the best. So we used to go to, you see, all these community places. We go to sauna, we go to club, massage palette places, because we know that are where the community is. You can't expect the community come to us, so we go to the community.
So diva, right? These people. We all need to go there and save their life, whatever. Like these people, okay, whatever. Yeah. Ooh.
Okay, so we have the Internet Outreach Program. Next, I'll be talking after this. Okay, so how the Internet Outreach Program actually works, it's a community-based it's a volunteer-based program, so we recruit the volunteers. So these volunteers are students from universities, or they are even adults who are working, but on a volunteer basis. So what they do, they will go through all these online apps. There will be a person there, so they will be giving information of HIV, how to actually, what is safe sex, what is unsafe sex, because many people on Grindr through our program realize that they don't actually know what are their risks. They feel that, I have very bad sex, BB sex, but I don't have sex with positive person. but they didn't know that how do you know that another person are not positive? And when you have sex, when you didn't use condom, you somehow increase the risk of getting HIV. So it's true that we give a lot of information to the community, to the MSM about the behavior they do, and if after they go through where can. Beside of that also, we also give them a lot of information where they can actually get testing, where they can actually get the potential medical help that they actually need.
Yeah.
So we targeted at a high-risk population group, and we link them to testing, and also we link them to treatment. For example, to KKKL, to KK and or even to hospital, Kelana Jaya, Sungai Buloh, so on and so forth.
And also the CHCC.
Yes, and CHCC to get the testing. Okay, so we produce certain videos regarding STI because we believe that when we talk about HIV, we have to talk about STI as well because they come together. You don't just get HIV, sometimes you got STI.
Oh yes.
So this is like an example of the conversation, how it would go. We don't just directly go in and tell people what is HIV. We always do rapport building first, where we build a connection and a relationship with the people, and then eventually we goes into the agenda that we're trying to, which is to persuade people to go for testing or encourage people to go for testing.
This is under grinder.
Yes, this is just an example of under the grinder. Next. Is your face there?
No.
Is your profile there?
No, just on my
Next. So this is another example of hornet.
Hornet.
Yes, of hornet. Yeah.
Si, point cuma tahu.
Should have seen this. Okay.
My client showed me.
Next. Okay, so we have our CSCC clinic. Next. So this is the example of the setting of our clinic. We have already moved our place. This is the last setting of the last venue that we have. Next.
Oh, sorry.
Okay, you can just go to the So this is the community-based training. So how it goes, it always starts with the pre-test first because we want to make sure that the client are actually prepared, understand what is the procedure they need to go through, or are they actually prepared already to have, to know their results, so on and so forth. So we have the HIV testing, then after that we have the post-test to confirm back with them about are they ready or not to know their result, so on and so forth. And at last is the referral care and support. So if they do test positive, where can they actually go? And in Malaysia, most of the time we refer them to Sungai Buloh Hospital to have the verification test. Okay. So now people are talking about PrEP all the time because we believe that PrEP should be another method that we incorporate together with the prevention policy because we keep on talking about preventing. But what about those people who couldn't prevent, engaging in unsafe sex? So we want to we want to tell people that, hey, there is such medication for PrEP where if they consume it can actually protect them from getting HIV before they're engaging in any sexually risky behavior.
So this one is coming up, still in the process.
But it is not free.
It's not free. We have to buy.
themselves because the government do give you.
And there is a lot of myth actually of PrEP because people believe that you can just go online and get the PrEP. But the question is that how do we know the quality of the PrEP outside there are actually the quality?
Genuine.
Yes, the genuine quality. And because in order to get PrEP, you need to get a prescription first from the doctor to know that are you actually at the needs of needing the PrEP, or are your body actually suitable taking PrEP, because the doctor will look at your blood level, your sugar level, so on and so forth.
Do a baseline.
Yes, we do a baseline to make sure that you are suitable in taking PrEP. And after that, we have MSM post program. So we believe that when you see the community get tested with positive, they need support because some people they can go through everything by themselves. Some people they just can't, and there will be a lot of questions, raising up throughout the whole process. What can I eat? What I cannot eat? What does that feel? Am I going to die? When is the end of my day? So there will be a lot of all these questions that we don't think of, but when you go positive, you will think of all these weird. Yeah, they do think of all these weird questions. So MSM post program provide. We have our staff there to accompany them to go to the clinic to serve as a social support, to give them emotional support and physical support.
That's
Well, I think this one.
Basically what you
yeah,
have
it's
said.
basically what I have said. It's a very holistic approach. So they accompany them. So they accompany them for the first
We
visit.
call them the outreach workers.
Yes, we call them the outreach worker. Yeah.
The hospital peer
And then
outreach.
this is the hospital peer
Sungai
outreach.
Buloh.
Our peer are most likely in hospital Sungai Buloh and then KKKL, KK Jeras, and some other different places. Next.
What is the picture?
So this is an example of when we go to do the outreach, we don't just go like that, because sometimes we know that all these clients, they might need certain things and the family member might not be aware of that situation.
Yeah.
So we buy some of the daily stuff they might need. So we go to the hospital, we go to the ward, we go to visit them, and we buy some daily needs that they want to provide them.
From donation.
Yes, from donation, from the public, or from maybe even our personal.
Sponsors.
Yes, our sponsors.
We got sponsors.
Treatment.
So these are some of the medication that we have in PT Foundation. Next.
Oh, the program.
So these are some of the example of the program that we actually did. We go out with the clients. Okay, sorry. Next. So we provide videos about awareness and also sensitization to understand the community better. What is transgender actually about? What is MSM actually about? Is there a difference of MSM transgender with the heterosexual people? So on and so forth. So we do all these videos to educate the public of what the community actually, different, not different. What the community actually want to tell the other people, what are the another side of the community, rather than what the social media keep on portraying, the deviant, the suicide group, so on and so forth. Gitu. So okay, so we come to the second chance program, the program that will improve the life of the children that are affected by HIV by giving them free education, teaching them tuition. Yeah, so these are some of the pictures that it shows. Sometimes it's a one-to-one tuition method, or sometimes it's in a group where a teacher volunteers, usually students from university, they are students from counseling background, psychology background. There are even mothers who are already retired, but they feel that they want to have this chance, to give education to children. They're willing to come and give the tuition to the children. Yes. So yeah, it can be one-to-one. Next. And then in the last time, because we have funding, we managed to organize trip. So we bring all the children together, we sponsor them. So we go to, I forgot where we went already. So but we sponsor them totally, so that the students could have a chance of knowing a part of studies whatsoever, what are the joy of traveling together with the other people. So, Asian People's Program, okay. So under Asian People's Program, we look at the strengthening community system and capacity, because we believe that there are a lot of training actually going on, for the community, but how to make it sustainable, which is by strengthening the community, so that in future, when the community, they are from different side of Kuala Lumpur, the whole Malaysia, so they could establish their own NGO, and how they can actually sustain within their own, their own places, and make sure that the community are constantly being empowered and getting the needs and help that they want. So it was sponsored. The funding was actually come from the Global Fund. Next. So these are some of the organizations that comes under our program last time, IHP. They are from, as you can see, they are from all part of the Malaysia. Some are from they are even from Sarawak. The partner organization from different side of the Malaysia. So these are some of the activities. We do community system strengthening. We teach them how to set up their own NGOs, how to do advocacy, and then we provide a little bit of small grants so that they could have programs to run on. Yeah, they have something to start off there, and they have programs that can benefit to their own community at the local level.
This community workshop.
So it's basically, I believe this is a part of what we have always do on the program. We'll conduct, variety of workshops for the community. Leadership training, next. And that's it. Thank you.
Okay, interesting. So we're done with the, let me just get our background. So we're done with the presentation. Thank you for both speaker. Okay, sekarang mari kita masuk terus kepada isu utama pada hari ini. Jadi
Oh, the issue rupanya.
Okay. Baru-baru ni saya baru pulang daripada satu kempen di Reben Merah. Kiranya ada agensi yang cuba buat kuliah ataupun ceramah berkenaan dengan HIV AIDS. And then saya tertarik dengan terma-terma yang mereka borak dalam tu, seperti satunya ialah seks rambang. So jadi mungkin kita boleh tanya opinion apa pendapat panelis kita, apa yang mereka faham mengenai seks rambang. Sebab saya rasa dalam komuniti LGBT atau terutamanya untuk komuniti yang ni, saya berpengalaman, saya dapat tahu mereka ada yang antara mereka yang tak berapa gemar perkataan seks rambang ni, nampak macam negatif sangat. Tapi apa sebenarnya seks rambang ni? So nak tanya pendapat apa korang rasa lah pasal seks rambang ni.
You want to go first? You are first.
Okay, now soalan susah ya.
Baru soalan pertama. Dah susah dah.
Sex rambang is actually more among the young people.
Gitu.
Okay, it's more among the young people, and then macam what Jeremy said, they have access to all the apps. So they have, and then they, as far as I know, they call it the chemsex.
Yes.
Chemsex.
Oh, okay.
Chemsex is
Chemsex is where
related.
it's also combined with drugs.
Mm.
Okay, it's not injecting drugs; it's oral drugs. They take oral drugs and they have sexual activities.
Mm-hmm.
All right. So this is quite dangerous
Yeah.
because when they combine drugs with sex, because if they are just sex only, they can still have their mind is still conscious of what they are doing.
Mm-hmm.
But because when they combine with drugs, they do not know what their activities they are doing. They may not be using the protection.
Mm.
They may not be using condoms during their sexual activities. So that is where sex rambang is quite a issue, and especially if they have it among the youngsters with chemsex.
Jadi Puan Ju nak definisikan seks rambang sebagai seks yang ada unsur dadah ataupun alkohol lah.
Yes.
Okay.
More of dadah lah.
Mm-hmm.
Among the youngsters. They take the ecstasies and all that.
Mm-hmm.
Because now there's so many drugs in the market, you can
Mm.
get very easily.
Mm-hmm.
So we have got a few cases having HIV through chemsex.
Jeremy, ada pendapat seks
Well,
rambang? Ya?
If you ask me about seks rambang,
Hmm.
okay, saya akan kata seks rambang adalah sesuatu yang sejenis seks yang membuka kepada apa-apa. So what do we mean apa-apa here? It's all the risk.
Hmm.
Because we talk about free sex. So when we talk about free sex, we need to talk about drugs, which I definitely do agree because it's something that going on in the community.
Mhm.
If you look at the gay apps, free sex is everywhere.
Mm.
And then, but the issue behind of free sex is that people are not using condom.
Yeah.
That's unsafe. The risk one is there. And when you have very bad sex, because when you have penetrative sex through anally, the risk is actually higher. So I have issue with free sex because of that, because you are putting yourself at a very risky places, and especially when now the community are so heavily depending on the gay apps, to hook up with people. We are actually using a very risky tools. Maybe the tool itself is not risky. The tool is just a tool. It's the behavior of the people in the tool that is risky. Not using condom.
Practicing safe.
Yes, not practicing safely. That is why safe sex is so dangerous. But you can have free sex, but if you practice safe free sex, it shouldn't be an
Using
issue.
condom.
Yes,
Yeah.
by using condom or you take PrEP or whatsoever, you might not have issue. So I would define free sex as something that open to variety of risks.
You see, for example, if I just want to put it like among the female sex workers, they are having sex almost every day.
Yeah.
But why are they safe? Because they use condom.
Yes.
Yes.
They have multiple partners.
I think that actually raises up to a very good issue if we look into the key population.
Yes, I'm talking
Why-
about key
why-
population because I do testing in brothels and on the road, on the bushes or anywhere where I can find these female sex workers. And in Alasta, when we went last year, in fact early this year, we only detected 2 cases of female sex workers who were positive among Well, I can say about almost 50 over patients.
Oh, okay.
Okay.
And then when we talk about sex worker, they can actually very easily access to all these contraceptive, condom.
Yes.
It's provided
Because
and
of
they-
the awareness
yes,
that they are
because of
so
the
afraid,
awareness.
and they do not. I told them, if your client don't want to use condom, what do you do then? Then they say
They
no.
reject the client.
They say no.
Yeah.
Even if he offer you
Yes,
double the money, you don't want.
they reject the client.
Nanti kalau sakit saya lagi susah, tak boleh cari duit.
Pelacur yang bertamadun.
Yes.
Syukur.
Dia kata saya tak nak sebab nanti kalau saya sakit saya tak ada kerja.
Okay.
So to them, safe sex is very important.
Yes,
That's why we are worried about
the younger
The younger
generation.
Yang bukan pelacur ni lah.
yang bukan pelacur, yang selalunya,
Yang bukan pelacur.
Yang selalu menjadi
orang
pelacur.
duk cakap pelacur. But
Kan.
actually, we are worried about the younger people who are do access to all these sex activities with the influence of drugs,
Hmm.
and they are not protecting themselves.
Yes.
Okay. Jeremy, you mentioned pasal PrEP, and there is a viewer question. Cakap, can people who are not sexually active take PrEP? Can you like give a brief explanation on
Okay.
what is PrEP, who should be on PrEP, and answering her question, can people who are not sexually active take PrEP?
Well, I think I would answer her question first.
All right.
Okay, can people who are not actively in sex take PrEP? Of course, my answer would be yes and no at the same time. Why? Because when you go to see a doctor, the doctor would go through with you the diagnosis to see whether are you in the needs or not. According to most of the doctor, they have a guideline. If you are sexually active, they will prescribe. They will consider PrEP as an option to you. But if you are not sexually active, most likely the doctor would recommend you using condoms.
Yes.
Most likely they won't.
They won't
recommend-
give you
They
PrEP.
won't give you PrEP. They look at that. They will do the risk assessment to look
We
at.
have a
whether-
checklist.
Yes, we have a checklist to go through
To
to
go through to
go
make sure
through
you are a good candidate for PrEP.
for PrEP. Yes.
So bermaknanya PrEP ni sangat-sangat limited lah. Tak hanya
Limited,
kepada
yes, and only prescribed by doctor.
Yes.
You cannot go and buy at the counter and take. It's very risky. Because it's actually, the PrEP is actually the virus suppression drug. So why would you want to indulge yourself in things that you are not going to do?
Yes.
So back to my question, like, can you just, since we begin the topic, like, okay, PrEP is a virus suppression drug, like maybe give a brief introduction to PrEP, like, and if there are people who are considering wanting to go PrEP and they are in the high risk, where can they get PrEP? So can we have that discussion?
Where?
Where? Okay.
Starting with
I don't
how
know. Okay,
how
I
does
don't
PrEP
know.
work in the body?
Yeah, maybe Puan Ju can
In
for people
Penang,
beyond.
okay, I can tell you about Penang.
Yeah.
Penang Hospital Pulau Pinang, my ID physician do prescribe for under the recommendation of our bring in by the father group, where we will bring our client to see her, and she will have the checklist done, and she will be the one who determine the patient. And we have the pharmacy that is selling at a good price in Penang.
Ooh.
It's pure pharmacy.
How much?
100 and I can't remember. 140, 130, something like that.
Something like that. around the range
130 or 140.
Okay.
Less than 150 lah.
So only
But
in
it was
Penang.
only it's only prescribed by the doctor. And also our father have our own doctor, Dr. Yip. She sits in the clinic, and if the client bring in by the outreach workers or anybody who claim themselves to be highly activities very high in sex, then we can recommend them, and we'll let them see our doctors. But I'm not sure about KL.
Well, in KL, we usually refer them to the PPUM.
Okay.
We refer them to
Cecair.
Yes.
Cecair is doing it.
Cecair is doing it. And in PT soon, because now we are transitioning into a clinic, so soon when we have a doctor, we could be able to prescribe PrEP as well.
I see.
Yes.
But in KL, you can go to PPUM. I know Cecair is doing it.
Well, I have some knowledge about PrEP too, since I'm taking PrEP. So, in KL, you can get it in two KKs, KK Ceras and KK KL, but
KKL.
they only give prescription,
You have to buy
and
it
you have to
yourself.
buy yourself at a pharmacy
pharmacies.
at the rate of like 140 ringgit.
Yeah,
But in PPUM, they sell it for 50 ringgit a month. But you have to be their patient in PPUM. So the records, they will be kept by PPUM lah. But after that, they will I mean, they will screen you first, like kidney function. I don't think they do bone
They do
density.
baseline.
Yeah, they'll do
Yes, they do
baseline. They'll make sure your HIV is negative first.
Yes. The most important, I
Yes.
forgot to say, is HIV must be negative.
Negative. You cannot take PrEP while
If you
being
are
HIV
HIV
You
positive.
will start hard directly.
It will.
already.
Of course.
It's positive, of course.
Okay. Well, thank you. Jeremy, can you explain, like, we haven't answered the question, like, what is PrEP? What does it do to your body? What is the side effects? And maybe, like, what are the advantages of PrEP?
Well, I think when we talk about side effect, because there are so many different testimonials of PrEP, some people say, it does make them feel tired. But most of the time we heard from other people that the testimonial is that PrEP doesn't actually bring much effect to their life. They feel that they're just taking one medication, and when this medication, protect them from getting the HIV, they actually feel pretty empowered, in engaging in sexual activity because they no longer feel afraid and anxious of getting HIV, so on and so forth. And what was your another question again?
Wait. There's a question from viewer. She said, did I heard that if you take PrEP, if you are HIV positive, your heart will stop? No, not your heart will stop.
Dia mana kat maut.
Highly active.
Highly active.
HAART.
HAART.
You will start the highly active antiretroviral. Yeah.
That is a short form for
Yes.
the highly active
Yes.
antiretroviral treatment.
Okay, all right. She understands now.
Okay.
So the next question is, okay, like, how do you take PrEP? Like, I mean, is it daily? Is it before sex, or what?
I think according to what we are having now is we have to consume at daily
Daily-
pills. But
daily
there was
pills.
this one approach,
Daily
the
pills.
3-2-1 approach.
Yeah,
No,
but
no.
that one's not.
That one
Very
is not in
complicated,
Malaysia, not in
yeah.
Malaysia.
Actually, maybe in US lah, but not. in
Alright, not recommended by the WHO also.
Yeah.
Alright, Mus, you can take over.
Okay, so isu seterusnya yang kita bincang ialah lebih kepada isu-isu remaja. Sebab remaja ni seringkali orang akan kaitkan dengan gejala sosial, teruk sangat remaja ni kan. So nak tanya apa pendapat korang mengenai remaja relate dengan gejala sosial. I mean, like, because right now, like, kalau kita tengok, thanks to the internet right now, like, semua jadi pelacur kan, semua jadi pelacur sebagai satu kejayaan, at least bukan
Tak berbayar masalahnya.
kan, semua nak percuma, seks nak percuma, tu nak percuma, tu yang dapat HIV tu. Okay. But yeah, apa pendapat anda mengenai, like, keterlibatan remaja lah dalam kerja-kerja advokasi HIV/AIDS kat Malaysia? Ya.
You lah the baca.
Okay.
Semua nak kongkek je kan, semua nak kongkek, tak nak buat kerja advokasi kan. So apa pendapat korang?
Okay, I think that yes, it's true. When we talk about advocacy, we hardly see any youth.
Kan?
You see, I am youth myself, and I can let me tell you something. I am only the youth who dare to come in front and talk about all these HIV things. Because you see, when we talk about HIV, itself, the information is so little. As a youngster, because when we talk about media, it's always numbers. It's always statistic. Okay, this is the number of HIV, blah 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 blah. But we always tell people that HIV and it's different. But how many young people out there actually aware that HIV and AIDS is different? And the question so comes down to why young people are not actively going to seek for all these questions, because it has been a taboo. That no one dare to talk about HIV, because when you talk about HIV, people nowadays link you to LGBT, people link you to become pelacur, sex worker. Why tiba-tiba you want to know about HIV? It must be something related to you. Are you HIV positive? You see, we have so many, all these personal attack, all this stigmatization. If I am a youngster as well, I will back off from this thing, and I will feel like, okay, rather than going into HIV, maybe I go to cancer, I go to diabetes, I go to high blood pressure, different kind of, is it concern or advocacy which can save me from all this stigma.
Bonjour, ada komen pasal ni?
For me, I think for this, remaja ni, because of their unlimited social networking, that they got into they want to try, and they end up, having all this, it depends on, like, you nak kata salah kawan ke, because sometimes the friends that they make through the social media, they don't. For example, my patient, she got HIV. She's a very young girl, 16 years old. She got HIV just from an abang who gave her a phone.
Huh?
Gave her a phone, gave her a handphone, and she got HIV because she had sex with him.
Oh, okay. Itu memang
Not just
how
give
do
the
you
food and
infect-
actually become positive.
No,
How
no, no.
phone
It
can
has to
contribute
be
to
done.
She got HIV by getting a handphone from this guy.
Oh, main phone buat seks lah.
A hand job ke a handphone?
I mean like aneh.
Food.
So you see, so sometimes it's ignorant
Hmm.
among the young people, ignorant,
Yeah.
very young and naive people who do not know what's happening, who are not exposed to all these thing, and you know they want to try, they do not know what they are indulging themselves in.
But I think also, like, just my opinion, I think the older generation is also like should take part of the responsibility too. I mean, especially in MSM community, you know, you see these daddies, you know, these older men who are taking advantage of
Of the
younger
younger
boys,
MSM, yeah.
especially like below 18, like they want like
Yes.
ketat, and I think they need to take responsibility too, to like, you know, if you're doing this to these younger people, you need to be safe, you need to be well equipped with the knowledge, you know, when you're doing this, especially to teach these younger kids consent, and you know.
The other thing is that I
Mhm.
just want to tell you all, especially the guys, why do anal sex you get higher risk than vaginal sex?
You want me to give
This
you
is a
answer?
question, or I have the answer lah.
I have,
I have the
Okay,
answer.
I'm asking you.
So the lining of the anal wall is much
Very
thinner
thinner.
compared to the vaginal lining.
So the risk is higher
Yeah.
among the male MSM
That's why it's
compared to
higher.
vaginal sex.
Yeah.
And like bottoming is more higher risk compared to
Yes.
topping. So I mean, and
The
especially,
recipient is higher than
So-
the giver.
I think these are the things that both older generation and
They should
younger
know.
generation should
I think
know.
the responsibility
you know,
falls
They
on
should
both
know.
Everyone.
sides.
Yeah.
Everyone. from
Everybody
the
should know.
Yes.
should know that, you know, if you are a top, you know your risk, and if you are a bottom, you know your risk, and you know we know the younger kids are bottoms. I mean, traditionally, like they would be subjugated to being the bottom with the older men, you know, taking advantage of them, you know, with their ketatness and kemutness and everything.
Yeah.
So I mean that's an issue another issue altogether, about how young teenagers are naive, they do not know, and when you are receiving guidance from these pedophiles, you know, this is how
Should be
HIV,
more responsible.
and this is how HIV and uh, STDs are spread through remaja, and they would repeat among their friends
Yes.
too. And when they grow older, they'll do it to other younger kids, and it's just gonna be the same
A
loop,
vicious cycle.
yeah, over and over again.
I mean, just to add on that, I think one thing we need to talk about in the community is about consent. Because consent is not only about I want to have sex, I don't want to have sex. But consent also about, do I want to use condom?
Yeah.
Do I don't want to use condom?
Yes.
Do I want to have bareback today? Maybe I don't want to have bareback today. So it's about all the communication that we are telling, you know, the elder is for everyone. The communication is for everyone in the community to know how to get the consent from another person of doing something that maybe they want, but another person they do not want.
I want to raise an issue here sebab for me tadi I pergi ke ceramah HIV AIDS tu. Diorang seorang daripada slot kekeluargaan ke apa benda.
So daripada
entah.
slut us, from the slot.
So sluts, you know, so dia bercakap like it's all about abstinence, you know, pencegahan, you know, and then dia cakap like jangan buat seks before nikah lah, apalah semua tu. And but for me, like part of ilmu seks, we all believe in sex, you know, you being positive about sex, and we all believe that tak semua orang boleh kekuatan untuk tidak melakukan seks. Yeah, so I think problem lah bila orang nak ada satu saja naratif yang cakap jangan buat seks before kahwin or whatever, even though we ilmu seks believe that you nak buat seks, be smart about it, protect yourself, protection and everything. So I think naratif macam tu problematic lah. Tu yang I terkejut tu bila I join event tadi tu, campaign tu by ministry, I mean under kementerian. So for me,
Ada pejabat agama sama? Ada pejabat
Is the
agama?
religious department?
I'm not sure, tapi tu lah, nama department dia kekeluargaan something. So tu lah dia. And then dia punya slideshow abstinent. I'm like, what? So I'm like, where am I right now? And then dia basically saying that you cannot have sex at all unless if you're married. So for me, it's a problematic because right now thanks to the internet also, like, you know, all of us turn into a very horny creature. So I'm sorry, we all born that way. So
So about abstinence method, about abstinence only lah.
I mean, dia cakap macam tu je lah. Basically dia macam tak nak langsung.
Dulu when we first started memang they say abstinence.
Yes. Like
But now it's not practical anymore.
just to follow up to that, you see, we look back to the statistics just now showing about the switches of the routes of transmission from the drug usage to the sexually transmitted infection. In the past, we were saying the same thing. When people do drugs and get HIV, we say the same thing. Jangan guna drugs. Dah, end of the story. You don't use drug, you don't get HIV. But is that the reality? No, it's not. And when we break this kind of stigma, that people are doing it, we accept the truth, that we know it's actually happening. So how we actually move forward on that, which is by using the harm reduction. Yes, how do we address using harm reduction, so on and so forth. So when we talk about HIV, we should actually hold the same attitude that, hey, people are having sex. We know that. Yes, they are preaching abstinence. How do we overcome
and
that?
prevent it from spreading?
Yes. And if people are really doing it, which is people are, how can we actually
That's why
prevent
we
it?
advocate the condoms, the free condoms, and also PrEP for prevention of sex activities, right?
So you see, from the youngster perspective, we always say that it's so easy for the adult to say a condom it's free, just and get condom, since that the stigma is there. It's so difficult for young people to actually get a condom. Even people say you can just go to 7-Eleven and buy. Who would walk in 7-Eleven and take a condom and then buy? In KL it might be easy. in KL it might be easy, but in different part of KL it's very difficult. So that's why we always encourage the community or the public, go to the NGO so that they have less stigma. I won't say there will be no stigma, because I do believe there are still stigma there. Yes,
we are giving condoms.
we are just giving condoms. So the stigma will be lesser, and people will be much more brave enough, you know, to get a condom. You come forward and get a condom to protect themselves.
Audience ada soalan? Mesti ada soalan.
Ada soalan.
Ini soalan specifically for Jeremy. You're doing the advocacy, right?
Filming or not?
Yes.
Are you okay with filming?
Yeah.
You're okay with filming? Okay. Okay with filming? Okay, good.
So my question is, how we as young people, how can we be part of that advocacy? Like, how do we even start being in, advocate for safe sex, for ending stigma against HIV positive person or marginalized communities?
Well, I always tell people that you don't have to join an NGO to do advocacy, because advocacy is the individual things that you do. It's all about the message that you're trying to bring out there to the people. For young people, what is the greatest treasure we have at the moment? It's technology. It's social media. You don't have to say anything about LGBT. You can share a little bit every day. It's about, so this is the basic myth that people have about HIV. Sharing same toothbrush will give you HIV. Eating the same meal will give you HIV. We can start to break down all these small myths, and then maybe after a while we start to give information. Actually, HIV transmitted only in through such way. So what do you guys think of the myth that we usually listen of? Use much more engaging method with the people when we do advocacy, so that we can deliver our message out there rather than just giving all this bunch of statistics and information. Because you see, when the LGBT and the HIV linked together in the few months before, still people are not concerning of HIV. People concerning of LGBT, but people are not concerning of HIV because of the approach we are using is very different. The focus already divert on the LGBT but rather than HIV. So it's always about the processing of the information that we're trying to deliver outside there. So as a youth, you can even start yourself as a solo by posting, by giving some information through your own social media, social platform. That would be great enough. Don't expect huge thing. Start small, because you don't know that small thing might somehow helps and become a big thing.
Question lagi kepada hadirin-hadiran? Gitu hadirin.
Hadirin-hadiran.
Gitu kan. Oh.
Okay.
Yeah. Another question, but for you. Have you read about the Dr. Eliami's statement on LGBT and
So macam sesi membawang terus lah.
Okay, jom kita bawang. Bawang please.
Can you comment on that? Why?
actually she also like, she's new, she's a new doctor. And maybe our physician also
shades,
said that maybe she doesn't have enough exposure. She is new and maybe she to most of I did ask my physicians, so they say that maybe her knowledge is not so and limited. Her experience is not so wide. And the other thing is that she put in her values into it, her own personal values. So when you do HIV, actually you must put aside your personal value.
Yes.
All right. For example, I am a senior. I am already retired. I'm a senior nurse counselor. I do not put my values. You see, I also a hajjah. I've gone to Hajj. I've gone to so many umrahs, but I don't put my values into it. To me, I go all out. Is number one is your nawaitu, your niyat. And anything in Islam is what you want to do. All right, what is your niyat? I never in my life niyat to encourage people to have free sex or anything. My niyat is to prevent the disease. In whatever they do, and I am not here to hukum anybody. Only Allah, okay? Only Allah saja yang boleh menghukum seseorang. We are in no position to hukum anybody. So who are we? Because we also don't know whether we are doing the right thing, and Allah only can hukum us. So the other thing is that you do not make judgmental statements. So she's wrong in that field. That's why a lot of people were against her. So that's why I would advise young doctors or young paramedics, I always tell them, don't put your values, don't be judgmental, because you are here, you must always remember what is your niyat. Your nawaitu is prevention. Prevention. The more you prevent, the more you can help more younger people from having to have a lifelong disease, right? Very early. Macam kalau you kena diabetic at the age of 40, 60, okay. But if you have HIV at the age of 14, it's a lifelong disease. Okay, itu je lah. That is what I would comment on her. Kesian lah, she is a bit inexperienced.
I forgot to ask. Recently ada conference about AIDS, right?
Yeah, we had our fourth
Conference.
national AIDS conference.
And I heard lots of great stuff, great outcome from is there any latest initiative by the government, by the way?
Yeah,
for
the latest initiative is we will want to try our best, maybe that's why I say to collaborate the Ministry of Education together with the Ministry of Health to do more more HIV awareness program among the school children. Alright, that is number one. Number two is we would maybe Dato' Christopher, our big boss, thinks that we can don't know lah whether we can afford in future to buy the 3-in-1, the daily hearts.
The one from which country?
And also we have the other thing from US.
US.
We also have the other thing is that the injection. Instead of taking drugs, you have the injection. In America, people just inject hearts.
Seriously.
So you see, that's all the latest that we got from our fourth National AIDS Conference that we are looking forward to. And also the other thing is that the research have not stopped. So they are still doing lots of research about HIV. So maybe we do not know, one day maybe one Australian doctor who says maybe he's already 60 years old, 60 plus. He said maybe another 20 to 30 years old, maybe 30 years later, we may have a cure for HIV. We're looking into that. We don't know. That's what they said in the National AIDS Conference.
There's a question from a viewer. One of my friend is gay, but he is monogamous lah. Would you still advise monogamous? Maksudnya dia satu pasangan je. Would you still advise to have sex with condoms or not?
Still, the question simple. How do you know your partner are same as you? Yes.
Even for me, for my patients, all right, for my patients, this is very important. Even if they are married, even they are both positive, we also want them to use condom.
Yes.
They are both positive and they are both on hard. Why? Because the virus can mutate.
Yes.
We're scared of mutation and they may fail the treatment. And second line is not free in Malaysia. at the moment, you still need
You need to pay
600 to 700 ringgit a
per
month
month. Per month.
to pay for your heart. Second line. So, please don't take that chance. You still have to use walaupun you are positive together.
Or even you are not
How-
sexually active.
Or you are not sexually active, or
only
your
one
your
sexual
partner is you are so faithful to him or whatever.
But
I
you never
think
know
you
about
never
another
know.
person. Mhm.
You never know. Don't trust.
Ada soalan lagi daripada viewer?
Tak ada. But on the question of even positive partners tak nak ni, but what about heterosexual partners yang positive but they want to have children?
Oh, there's
But-
no problem.
No.
Children is not an issue
Yes.
now. So once they want to have problem, if they are both positive, you mean? Yes, we can do IVF.
IVF.
Okay, we can take the sperm, and then when and the most important is the virus must be undetectable. Okay, when the virus is very suppressed, and the virus, then we can take the sperm from the male, and we can inseminate, and we can have she's already on heart, and then she can have a pregnancy, and the virus will not pass into the placenta.
Alright. Okay, cool. Okay.
One of the issue that I nak tanya pasal statistik is that kita berbincang pasal kes yang dilaporkan dan yang tak dilaporkan, reported or not reported. So apa halangan untuk cover kes yang tak reported ni, meaning that they are not being honest or we did not have enough outreach to the community. Yeah, so yeah. What do you think?
The thing now is that we do not have enough outreach, and the other thing is that people are afraid to come forward.
Yes, totally agree with that.
So you not outreach meaning that you need more money?
Yeah, we need more funding. That's why we are
Dengar.
talking about the 4th National AIDS Conference.
Yeah.
We are looking for more funders to get more outreach workers among the community, human power, so that we can go out and do more outreach program and bring them in for testing, and at the same time to give more awareness.
I think awareness also, because we are encouraging people to go for testing so that
Yeah.
we can actually fill up the gap whatever we are having here.
Yes,
Because
yes.
many people, they don't know about their risk, they don't go for testing. So all this awareness need to be done so that people are aware of their situation. Then more people can go for testing.
You can talk about
Yeah.
HIV. HIV has been in Malaysia for about 20
Since-
over years.
Yes.
Alright, since the first case until
1986,
today.
yes.
Right, until today, you can have people who still do not know why you get HIV.
Yes.
Now it's already the 21st
21st
century.
Mm-hmm.
What you're talking. So it's actually awareness
Awareness,
is
yes.
so important. That's why we need people to go out there and
To
reach them.
talk about HIV.
This might be related to Ilmu Seks initiative, but what's your thoughts about being sex positive?
You mean as an individually being sex, having the thought of
Yeah, because
sex
because
positive
just now you mentioned about we as Asian might have this taboo of being positive about talking
Yes,
about
yes,
sex.
about sex.
Yeah, what do you think about because we in Mussy we really encourage people to have positive discussion and open discussion about sex. So at least kita saling mengenali, sayang menyayang gitu kan. Yeah, so what y'all think about being positive about having sex and stuff like that
That's
in
right.
Malaysia? Yeah.
You cannot. I mean, macam for the older generation, you have to move on. You have to see what is the needs of the young generation now. It's not. You cannot compare when I was 40 years ago. When I was a teenager, it's different. In the 60s, in the 70s, it's different. We do not go out at night. 6:30, we are already at home. So those are things that you cannot compare. So you have to move on with them. Otherwise, you lose them. That's my advice for the older generation. But for the youth, you talk about the
Wow.
youth. You are a youth.
Well, I think everyone should have the freedom of actually having control of their own body.
Yeah.
I won't say being sex positive is a good thing or bad thing, because it comes to individual value.
Yeah,
Whether it's good or
individual
bad, I can't
values.
speak for everyone. I can't speak for all the youth. But I always say that being sex positive or negative is an individual right, and it's empowerment. It's a sense of empowerment. So if you are so-called sex positive, I have no issue with that. But it's to aware of what does being a sex positive do to you, and knowing all the risks. And it's all about how to protect yourself, because we cannot control your behavior. I believe we can't stop someone from having sex, but at least we can teach them, if you want to have sex, what you can look into, how you can take care of yourself, and if really you engage in unsafe sex, how you can protect yourself, where you can actually go and seek for help, what kind of information you can look at, what kind of website you can access to get the right information, so that you can ensure that your sexual and reproductive health is at the best. Yeah.
Shane, do you have any question online?
As of now, no, not yet. Just promoting on
Promoting on what? Oh,
social media.
on social media. Question?
People would like to get HIV testing done. Where can they do it, and where can they also feel safe to do it and not be judged by
Oh, yeah.
the healthcare providers? If
Friendly,
that's an option, lah.
yeah, friendly places to do HIV check. Yeah.
Well, in Penang, I can tell you, Father does HIV testing free, and then in KL, even PT do it free also. Even class also do it free. Most of the partner organization under MAC, you can contact MAC and get the names of all the partner organizations. They do community-based and also free testing at their premises for free.
But for PD, I need to clarify a little bit.
PT, where do they do for that?
We have they can do the testing at CSCC in Sentul, but
okay.
usually you need to pay. But for those clients where they have financial issue, they could not pay, we would just provide a free.
You go and take the because all
but
the,
they still have to pay for
because
it.
we from the partner organisation of MAC, we get our test kits from Kementerian Kesihatan. They give us free. So we have volunteers like contoh nurses, doctors who do the testing for the clients. We have fixed dates where we can bring them to the venues to get themselves tested with no issue, or we can go to their community to do it for them. That's even better. We call it community-based testing, where we go to the community, we can organize, maybe in one place, we just go there and
Ask the
then
community to come.
all of them come, and then we'll just do it for them.
Yeah.
I have done so many for transgenders, for MSM.
But yeah, for me, that's a very interesting question. But right now, like when we talk about friendly clinic or doctors or being staff, so like, ada tak sebarang inisiatif daripada government sejak daripada conference AIDS tu yang like akan push lagi agenda untuk semua staff kena
Kementerian
layan?
Kesihatan, yes. Kementerian Kesihatan without fail is giving ongoing to all their staff in klinik kesihatan to receive all this key population in the klinik kesihatan for their community, for their testing. But actually, having said that, it's actually not the Kementerian, it's actually the attitude of the person.
The healthcare provider.
Maybe the healthcare provider. I would say, I as a senior nurse, I'm the first ID nurse trained by Datuk Chris in Penang State, and I have gone through all the klinik kesihatan doing echo training for my staff about stigmatization.
I know
Among
desensitization.
all these things in the clinic, and I do get occasionally one or two girls. Actually, it's attitude and your own upbringing.
Yes.
It doesn't. This thing you tak boleh judge to say, oh, Kementerian Kesihatan. But actually, Kementerian Kesihatan.
It's not on them.
Yes, it's not on that. Actually, Kementerian Kesihatan have been having ongoing. I tell you, I have gone to all the klinik kesihatan. We have, in fact, in Kedah and Penang State, I am the trainer. So I do not know about KL. In KL, I'm still new. Just about May, I was elected. But before that, but I can tell you about Northern State. I even go up to Ipoh. Kementerian Jabatan Kesihatan Negeri Ipoh also invited me to do this training for them. I've gone to police also. So actually, we are there to provide the service for the. It's just that they need to come. That's why now we have our partner organisation who are bringing in our clients to all the klinik kesihatan, and the doctors and nurses accepted them with no problem. You can go to KL klinik KKL or KK Ceras You see all the FMS are very friendly, the nurses there, because they are being exposed and Hospital Sungai Buloh.
And just to add on to that, what are the other initiatives that the government have done? Because I was in with the MOH, they are developing this one module for the key population, one module, and for the healthcare provider, one module. So this module is to teach the healthcare provider and also the community how to break stigma and discrimination within their own community. Because we community, we stigmatize each other most of the time. And even for the healthcare provider, we are coming out with module to teach them how to understand the community better, so that you see those healthcare provider in rural area could aware of, could understand the community better. They don't have to necessarily come to Kuala Lumpur to have the trainings, the desensitization training, but at least they have a materials to refer to have a deeper understanding of what is the community.
We have done that.
So we have a question from the chat. So it's about like the English dia macam, a person feels self-love that they want to let themselves dying even though medicine availability to him after he know he is HIV positive. Why they have that self-revenge? So basically, kenapa mereka masih like walaupun dah ada ubat advance sekarang ni yang boleh membantu HIV positif sampai tahap undetectable, kenapa mereka masih macam macam membunuh diri lah, macam give up, macam tak percayakan modern medicine, mungkin pergi ke bomoh dulu, buang jin HIV dulu, tapi masih tak membantu mereka, and mereka macam apa yang buat mereka macam tak suka dengan treatment sekarang yang ada, atau apa yang penghalang HIV positif untuk mendapatkan treatment?
Maybe to me, HIV positive, they need to meet people who are living with HIV and who have got a fairly normal life, and these are the good peer supporters for them to see that. Usually what I do is I get all these good people living with HIV to be with me in my group, so that I'll bring them for my new clients. They will share because they have gone through all that. We can talk, but we have not gone through it. So they are the best candidates to give assurance to the newly diagnosed patient who almost give up, don't want to start treatment, don't want to continue their life. So these are and they always come up with that. They bimbing them, they bring them to the clinics, take the medicine, teach them, and they even answer calls even at 2 a.m. in the morning. Yes, my peer support group. Okay, so these are the things that you need to advocate for them, so that they will get. And the other thing is that if I will tell my patient, the first thing I will say, this is not a hukuman that you're going to die. Allah don't want to take you yet. It's not your time for you to die. Because if you do not take, if there is a medicine for you to eat and live, and if you do not take, apa hukum dia? I ask back the patient. In Islam, it's hukum bunuh diri. And what happen if you bunuh diri? So you can ask if it is a Muslim, or it applies to all religion. You cannot kill yourself because there are the ubat. Contohnya, if you, let's say I tell you today you have diabetic and you do not want to take, you go into diabetic complication.
Yes.
Or if you have a high blood pressure, you do not want to take medicine, your blood pressure shoot, and what happen? You go into stroke. It's the same.
I think it comes with a lot of misconception
and educating them about heart. The important thing about taking the medication.
I think people have this kind of mindset that eating Western medication comes with a lot of
side effects.
You will become very
side
tired.
Effects, you don't worry.
Work.
Side effects, don't worry. All medicine have side effects, regardless. But once you dah makan, your medicine dah ngam with you, your side effects disappear.
Yes, your side effects disappear.
Just the initial part memang ada some side effect, but after that no more.
So I do really with what she say. It's about giving information and
Yes,
also bringing all these
educating them.
experience. Yes.
Bringing people who have been living with heart for many years. I have my good peer support group who have been taking heart for 20 years, and she has been helping so many patients. Because she's so well, she can work, she can look after her family.
Okay.
So she's a very good example.
So there's another question pula. how should I treat a person or friend who has HIV or AIDS? So if you're like HIV negative, you have a HIV positive friend, like how do you treat them?
You don't see AIDS nowadays.
Or you mean treating as a person?
Like as a
not treat them
person,
as
like
a
yeah,
behavior?
maybe
How
like
to react? Is it?
how to
As a normal person.
As a normal person.
Yeah, she can be your best friend.
Mhm.
I think it's like putting yourself
I have gone through programs where I live in the same room with people living with HIV
Yes.
in a hotel. I share the same bathroom with them. I sleep on the same bed with them.
I think it goes back to education.
Education.
Educating how HIV transmitted. So when we know aware of all
Yes.
those things, we won't
Yes.
behave differently than anyone. That question would automatically go eliminated.
I started with HIV patient in '97. Okay.
Oh
Until
my.
today.
We have
That time already got hard, right? 97.
Yes, only
Okay.
single dose AZT. Only
Mm.
one tablet AZT.
Already one tablet there.
Masa tu baru satu je tablet kita bagi.
Ah.
We do not have the 2-3 combination.
Oh.
Only in 202 only we started giving
yes.
the 3 combination. At that time, people have to buy. They have government give you one free, you buy 2, cost you 1,200.
Oh my.
You tak ada 1,200, you mati.
That's a month.
That's
is it?
why we
My
lost
God.
all the patients. You
That's a
see
month.
the statistics.
That's a month.
There you see all the statistics, the number of
Mhm.
death.
Yes.
Alright, that is where in 2002. All the male die, so sorry. Female are given free when they are diagnosed as HIV positive during the antenatal checkup.
Oh.
Alright, so you see more females alive at that time. Because we give our treatment free for females. But 2009, we give to all, regardless,
Male
female or male
Mm.
Malaysian free. 3 combination hearts.
Nice.
Okay?
Alright. Mus?
Oh, any question from the audience?
Ah,
Ada lagi?
No more question from the audience.
Ada.
Okay, I think pukul 6 I have to stop because
Okay.
Yeah.
Sure.
I just want to ask a question.
Yeah.
Yeah.
So if someone pergi klinik, right, and he cannot afford to go other clinic, tak banyak option. So and then he found out that the doctors macam somewhat judgmental kan, macam the staff kat klinik tu macam judging him for what are the avenues for him? Can he not complain or like if he feels that he's being discriminated?
Very good question.
That's a good
Very
question.
good question.
Very good question.
Messi.
Back to you.
Okay, what I do is, you see, if you feel that you want to go to the clinic and you know you'll be discriminated, you know the people there, you know it's from your country, your own hometown, you're so scared people will stigmatize you, no problem. We can refer you to another
Friendly clinic.
Friendly clinic. Which is out of your community. Katalah contohnya, you see I have patients as far as, dulu I have patients as far as Ipoh coming down to Penang to get treatment. Why? Because they don't want to go to Ipoh GH. I have people from mainland Penang refuse to go to come to Seberang Jaya to get the treatment. So I send them to hospital Pulau Pinang. They don't mind taking the bridge or taking the ferry. We refer them. There's no problem, no issue.
I mean, to add on to that, how we can actually make a complaint if we feel they were being discriminated or whatsoever. Try to talk to the case worker or the
Yes.
outreach worker at the particular
Yeah, the other
hospital.
yeah.
Tell them, and they will go through with you the process of doing an incident report, and they will settle the rest. But approach the
Yes.
case worker who are friendly, who are willing to listen to your stories, or outreach worker there in the particular hospital.
Like every hospital, they have their own outreach worker.
Yes.
Oh.
Yes.
FADA covers Hospital Seberang Jaya and Hospital Sultan Abaya, whereas we have another community-based, we have another organization, partner organization, CSP in Penang State. They cover the Hospital Pulau Pinang. So they have all the outreach workers in all these clinics. And we have our outreach workers who bring to all the clinic kesihatan in the northern states.
I think
Same thing
it
is
depends on states, because in developed states like Penang,
KL,
KL, you have no issue.
because we have so many
Outreach
outreach NGOs.
Mhm.
But we also have in Kelantan.
Yes.
We have Kelantan. We also have in Terengganu. We have in Ipoh. We have the buddies in Ipoh. We have Johor Life Zone.
pun tak ingat.
Johor Life Zone from Johor, and we also have the Pahang punya ni. Pahang, what they call themselves? Pahang,
The drugs punya NGO tu.
yelah the Pahang drop-in,
Merdeka.
Pahang drop-in punya group, the drop-in center.
I know the name.
I
I can't
forgot
recall
the
the
name.
name.
They have in every state, boleh katakan every state.
In
they have.
Committed Malaysia.
Yes.
Committed Malaysia.
Committed Malaysia.
Committed
They
Malaysia.
have Committed Malaysia from Pahang. And then like smaller places like Seremban, they come to KL. And then like Melaka also, they go to, if they are nearer to Johor, they go to Johor. And the one nearer to Seremban, they all come to KL. Because
But-
KL ada banyak.
I can give another recommendation what you can do. For example, if you're from rural places or Terengganu, where maybe in that town itself don't have outreach worker or case worker or whatsoever, you can actually call NGO in Kuala Lumpur. Then we
Call
can help,
MAC.
yes, call MAC, MSC or call any
Might have
NGO.
all the names of all the
Yeah.
partner organizations.
Then we could stay in contact with the organization in your states to assist you about how to make the complaint, so on and so
Yeah,
forth.
partner,
The
MAC
partner
or,
organization.
Okay, any question? No more? Okay. Chin, can you check yet?
Checking. I think that is all for the question.
Yeah.
Wait. Thanks. Okay. Well, the viewers say thanks. Thank you for all your knowledge and awareness and everything and info. So bagi kata penutup lah.
I don't know how to close. But for me, like, even though kalau kita menutup pun doesn't mean that we gonna need to tutup the discussion.
Yeah,
Like,
no, we
yeah.
should stop
This is
ours.
open.
Yeah,
Discussion
this is just part of the Ilmu Seks punya initiative because we always love to encourage people to have the open discussion about all these things. Because like for me, I really want to have these discussions because I don't believe the government. Every time they do the event, it's still they're gonna try to add something like to stigma. They're still living in the stigma. So like for me, I don't like. For me, like I love about Ilmu Seks that we try to counter them back or like live up a culture, open culture that we are here to say that what we want to say and to provide a much better, healthier community, open community to talk about stuff relating to health and sex education. But yeah, me Mussy part of Ilmu Seks, sangat-sangat terima kasih dengan panelis kita orang pada hari ini, even though tak ramai, but really appreciate it. We have a very good conversation from the young and old generation. Thank you for our audience. Thank you for all yang ni. Kalau korang banyak duit, jangan lupa donate dekat NGO, dekat Ilmu Seks or whatever. We sell our merchandise, our t-shirt. Yeah, someone is going to use the space. So yeah, we have our merchandise selling online. So yeah, keep in touch over there and yeah, see you around. Ilmu Seks diwawakan pada anda oleh orang yang mahukan seks yang hebat dan selamat. Is it the line?
Yeah, that's the line.
Yay!
Oh, I'm so proud of you. You still remember the line.
Thank you. Bye.
Thank you for sharing. We need more people like you guys
Yeah.
to